Day one protocol: complete your breathing, complete your cars, pick 2 joints, 1 minute each. 3 is going to be your pails and rails. I'll explain those in just a second. And 4 is going to be an integrated movement. Let's talk briefly about the fundamental motions for your hip. Your hip is a ball and socket joint, which means that it is built to rotate. The 2 fundamental motions for the hip are going to be external and internal rotation. External rotation means that your femur is rotating externally out away from the body. So a lot of the front half movements require external rotation of the hip. And internal rotation, hip internal rotation, where the femur rotates inward towards the midline. If your hip lacks rotation, then functionally you don't have a hip. So the first thing that you need to do is get that hip to rotate. For today, day one, we're going to be working on internal rotation of the hip. The setup is going to be from 90-90. As we're working in these positions, remember, our focus is on our body. We want to improve the tissues of our body, not be exercise focused. So don't worry so much about replicating any form or position exactly. Find the form or the position that best works for your body, that allows you to feel the tissue working in the way that you need it to work. Once you're set up, find a stretch on that back leg side. What I find helps sometimes is rotate. You can lean back to create more space in the joint capsule and have a little bit more access to the tissue. If you're tight, sometimes way up here, you might get that pinching sensation that will not work through. Lean back. If you need to, twist towards that leg and find a stretching sensation, deep stretching sensation in that joint caps. Don't want any pain running down to your knee. That means that your hip does not currently have enough rotational capacity, and that force is translating down to your knee. Keep that stretch in the underside of the joint capsule. Anywhere through here is going to be okay. Find that stretch. Do deep breaths for 30 seconds. After that 30 seconds, you're going to mentally try to connect to this underside tissue that's stretching. Use that tissue that's under stretch and start pushing down both at the knee and the ankle, and a little bit harder at the ankle, so that you create a rotational force through your leg. Nothing's moving. This is an isometric. All of the force is going into that stretched tissue in your hip joint. Push down for 30 seconds, working up to your desired intensity. At the end of that 30 seconds, stay in the exact same position, just reverse the contraction. So now you're trying to rotate your foot up to the 12 o'clock position. Internal rotation of that hip. Lift that foot, rotate, and squeeze. Now you should feel all of that top side tissue. Squeeze it. I'll work. Ramp that up, keeping the tension only in the deep hip capsule. So we don't want to use our hamstring. We don't want to compensate by leaning forward. Squeeze only the muscles on and about the hip to create that rotational movement. Squeeze. 30 seconds. Repeat for the desired number of sets and time. Lastly, choose an integration movement that helps you feel smoother. I would recommend hip hinge for your internal rotation. What you're doing here is feet are staying about shoulder width apart. Keep your balance. Keep your balance on your feet. Quick note, tripod balance. Base of your big toe, base of your little toe, and center of your heel creates that triangle. Nice tripod. Always keep that planted. You always want to push through tripod foot balance. From there, you're just going to hinge at the hips. So bend those hips back. Knees will be soft. Bend them as much as you need to to keep that tension going through your hamstrings. Push your butt back as if you're trying to touch the wall or close a car door, close the refrigerator door with your butt. Back stays flat. Tension goes into the hamstrings. Bring it back up. Push back, working into that posterior chain, and come out. Repeat that for desired time or number of repetitions.